So we have completed about the muscles of the back of the thigh, which include the semimembranosus, semitendinosus, biceps femoris, and the adductor magnus. Now moving on to the very important LAQ of the back of the thigh and a frequently asked questions in the university and the internal exams, that is about the sciatic nerve. Also the clinical included is about the sciatica. Sciatica पे बहुत frequently viva में या फिर जो है in the theory paper it is asked. Now talking about the the sciatic nerve has a root value of the L4, L5, and L4, L5, S1, S2, and the S3. It is made up of two parts. First is the tibial part, and second is the common peroneal part. Talking about the tibial part is just made up of the ventral divisions of the L4 to S3, whereas the common peroneal part is made up of the dorsal divisions of the L4, L5, S1, and S2. टीबियल पार्ट हमारा S3 तक है, whereas अपना dorsal division से जो common peroneal nerve बना that is only up to the S2. So now talking about the course of the sciatic nerve, this is a very good diagram which explains the entire course and the relations of the sciatic nerve. An important point has to be noted, you can see that this is the backside or the posterior surface of the sacrum bone. So the person is facing towards this, that means that this is the backside of the person from where which we can see his buttocks. Okay. Now talking about the root value, it's done. Talking about the course of the sciatic nerve, so the course can be divided into the three parts. That is first in the pelvis, then in the gluteal region, and then in the thigh wala region. Now talking about the pelvis, in the pelvis the sciatic nerve lies in front of the piriformis muscle. In the pelvis, the sciatic nerve lies in the front of the piriformis muscle. In the gluteal region, the sciatic nerve then enters the gluteal region through the greater sciatic foramen. You will learn that here is the greater sciatic foramen. It enters the gluteal region through the greater sciatic foramen below the piriformis. You can see that this is below the piriformis. यहाँ से common peroneal nerve है, यहाँ से tibial nerve. Tibial nerve and common peroneal together are known as the sciatic nerve. Okay. Now from here it runs slightly lateral, passing between the ischial tuberosity and the greater trochanter. So this if you are done with the bones wala part of the lower limb, this is the greater trochanter and this is the ischial tuberosity. Oh sorry, this is the ischial tuberosity. It passes between the greater trochanter and the ischial tuberosity. So ये दो diagrams है जो you can very clearly write about its course in the pelvis and the gluteal region. In the pelvis, it runs below the piriformis, whereas in the gluteal region, it enters the gluteal region to the greater sciatic foramen by passing below the piriformis in between the ischial tuberosity and the greater trochanter. Now, talking about its course in the thigh region. So the sciatic nerve enters the back of the thigh at the border of the gluteus maximus. Then from here it runs up to the superior lateral angle of the popliteal fossa. So here we are having the popliteal fossa. At the superior angle of the popliteal fossa, that is at the junction of the upper two-third and the lower one-third of the thigh, it terminates by dividing into the tibial part and the common peroneal part. Now, so this was entirely about the root value, course, and the origin of the sciatic nerve. Now, talking about the relations. For relations, this I will tell you. The diagram bus rut low, you will be, very well organized with the relations of the sciatic nerve. Now, talking about the relations of the sciatic nerve in the gluteal region. In the gluteal region, if we see the posteriorly, we have the gluteus maximus muscle. थोड़ा बहुत imagination भी रखना चाहिए. यहाँ पे we have the gluteus maximus muscle. Whereas in the anteriorly first of all देखो इधर है in the gluteal region. If we see anteriorly, we have the body of the ischium, the tendon of the obturator internus with the two gamellae. Gamellae. Yeah. See. अब ये वाला अगर देखोगे तो बॉडी ऑफ द ischium है हमारे पास, obturator internus with the two gamellae, quadratus femoris, adductor magnus, and the sciatic nerve. Adductor magnus और ये हमारा sciatic nerve. So talking about the anterior relations, I repeat the anterior relations: the body of the ischium, the obturator internus with the two gamellae, the quadratus femoris, adductor magnus के भी सिर्फ if we see the upper and the transverse fibers. So these are the anterior relations of the sciatic nerve. Medially, if we see, we have the inferior gluteal vessels. Medially, we have the inferior gluteal vessels here. यहाँ पे दिखाया नहीं है डायग्राम में, बट वी हैव द इंफीरियर ग्लूटेल वेसल्स. तो ये है उसका रिलेशन विद द ग्लूटेल रीजन. टॉकिंग अबाउट द थाई, इन द थाई द पोस्टीरियरली वी हैव द लॉन्ग हेड ऑफ द बाइसेप्स फेमोरिस. ये देखो, ये यहाँ पे पूरा सा मसल ये कंप्लीट होगा. तो पोस्टीरियरली, क्योंकि फेसिंग इधर है, तो शायाटिक नर्व के पीछे वी हैव द लॉन्ग हेड ऑफ द बाइसेप्स फेमोरिस. Anteriorly, we have the adductor magnus muscle. Anteriorly, we have the adductor magnus muscle. Medially, if we see, we have the semitendinosus and the semimembranosus muscle. Whereas laterally, if we see, again, we have the biceps femoris muscle. So talking about the relations in the thigh, if we see posteriorly, we have the long head of the biceps femoris muscle, which can be seen here. Anteriorly, we have the adductor magnus muscle. Medially, we have the semimembranosus and the semitendinosus. Whereas laterally, again, we have the biceps femoris. Okay. Now, talking about the branches of the sciatic nerve, if we see, first of all, articular branches, जैसे हम हमेशा बोलते हैं, I'll show you in the theory वाला part. Okay. Articular branches, it supplies the hip joint. Muscular branches, tibial part and the common peroneal part. Muscular branches. तो tibial part जो है, I have another diagram. Yes. See, this is the tibial part, whereas this is the common peroneal part. Tibial part supplies the semitendinosus, semimembranosus, long head of the biceps femoris and the adductor magnus. So this is, अगर हम बोलेंगे, ये पूरे hamstring muscles हो गए. हमने जो मसल का जो मैंने वीडियो कराया उसमें बताया था hamstring compartment के क्या क्या peculiarities है. The common peroneal nerve supplies only the short head of the biceps femoris as a part of the sciatic nerve. Okay. So Viva में generally you are asked to spot the sciatic nerve, and along with it the examiner will ask you that tell me the branches and the nerve supply to the muscles. The muscles which are supplied by the sciatic nerve. Make sure you just don't take the names. You tell it has the tibial part supplies the semitendinosus and membranosus, long head of the biceps femoris, whereas the common peroneal part supplies the short head of the biceps femoris. Make sure that whenever in the Viva you are asked about any nerve, even if the examiner doesn't ask about the root value, make sure that you mention the root value. Okay. ये पायरिफॉर्मिस, ये हमारा पूरा ग्लूटियल रीजन, ये थाई वाला रीजन. ओके. सो ये डायग्राम और ये डायग्राम. शायाटिक बेड मेरे को मेरे वाइवा में पूछा था, तो मुझे मैं याद करके गया था. तो इसलिए रिमेंबर द शायाटिक बेड इज जस्ट द एंटीरियर रिलेशंस ऑफ द शायाटिक नर्व इन द ग्लूटियल रीजन. ओके. So branches clear. Tibial part semitendinosus and membranosus long head of the biceps femoris and the ischial head of the adductor magnus, whereas the common peroneal part supplies only the short head of the biceps femoris. Okay. एक बार क्विकली ये थियोरी रिवाइज कर लेते हैं. बैक ऑफ द थाई फ्लेक्सर कंपार्टमेंट होता है, शायाटिक नर्व इसको सप्लाई करती है, विच इज द थिकेस्ट नर्व इन द बॉडी. ओरिजिन की बात करेंगे, लार्जेस्ट ब्रांच ऑफ द सेक्रल प्लेक्सस, रूट वैल्यू L4, L5, S1, S2, S3, मेड अप ऑफ टू पार्ट्स, tibial part, common peroneal part. Tibial part, ventral divisions of the anterior primary rami, whereas the common peroneal part, dorsal divisions of the anterior primary rami. Root value L4, L5, S1, S2, L4, L5, S1, S2, S3. In the pelvis, it lies in the front of the piriformis. देखो इधर it lies in the front of the piriformis. In the pelvis, in the gluteal region, it lies below the piriformis, or enters the gluteal region through the greater sciatic foramen below the piriformis, and you are include the point that it lies between ischial tuberosity and the greater trochanter. And the greater trochanter in the thigh, enters the back of the thigh, the lower border of the gluteus maximus, runs vertically downward to the superior angle of the popliteal fossa. At the junction, terminates in the tibial and the common peroneal part. Relations in the gluteal region, gluteus maximus, posteriorly, anteriorly, body of ischium, quadratus femoris, capsule of the hip joint, obturator internus, with the two gemelli, FS superior and inferior gemelli alak se and the obturator externus. Medially, inferior gluteal nerves in the thigh, posteriorly longer to the biceps femoris, medially semitendinosus, laterally biceps femoris. Branches clear. डायग्राम, लाइन डायग्राम देखो ये बनाना है. फर्स्ट ये ओरिजिन और रूट वैल्यू दिखाने के लिए, उसके बाद ये ब्रांचेस दिखाने के लिए, जिसमें जो अपना टिबियल पार्ट है दैट इज सप्लाई द सेमिमेम्ब्रेनोसिस longer to the biceps femoris, and the hamstring part of the adductor magnus, whereas the common peroneal part supplies the shorter of the biceps femoris. Now coming on to the clinical, which is related to the sciatic nerve, that is of the sleeping foot या फिर the sciatica. So अगर sciatic nerve आया तो डेफिनेटली स्लीपिंग फुट और sciatica लिख के ही आना है। एनाटॉमी के कोई भी क्वेश्चन में क्लिनिकल पूछा हो या ना पूछा हो, चुपचाप लिखने का, एक्स्ट्रा मार्क्स मिलेंगे। Now, talking about the sleeping foot, what happens? The sciatic nerve, since it is in the gluteal region, if we see that if we are sitting for a long time on the edge of a hard table or chair, so the nerve gets compressed. So the nerve gets compressed, between the edge of the table and the femur. क्योंकि femur का भी greater trochanter के वो वहां से pass होता है, तो it gets compressed between the edge of the table and the femur. So it causes a numbness along the lower limb. You will have experienced this many times. So this is called as a sleeping foot now. But when you hit your foot on the ground, the sensations come back. So this when the loss of the sensation because of the sitting on the edge of the table sometimes results in a temporary numbness found in the lower limb. This is due to the compression of the sciatic nerve. Sensations come back when the foot is hit on the ground. This is called as a sleeping foot. Sciatica, if we see, shooting pain along the distribution of the sciatic nerve. Chiefly here, it is involved the common peroneal nerve. Now, what can be the reasons for the sciatica? Maybe due to penetrating wounds or the dislocation of the hip joint. Hip joint is also supplied by the sciatic nerve, which can result into the sensory loss along the cutaneous supply of the sciatic nerve. Therefore, the motor loss, which includes the hamstring, loss of the dorsiflexion and loss of the plantar plexus. Loss of the dorsiflexus and the plantar plexus. कभी कभी हमें sciatic nerve injury के reasons पूछते हैं, एक तो due to hip joint या फिर include the point of the, हाँ इधर लिखा है मैंने, cause can be disc prolapse या फिर the neuritis. Disc prolapse is ये हमें जनरल एनाटॉमी बता दिया है कि कंप्रेशन ऑफ द sciatic nerve होता है, ठीक है, because of the herniation of the disc of the of the इंटरवर्टिब्रल डिस्क जो है, जिसमें वो न्यूक्लियस प्रोपलियस और एनुलस फाइब्रोसिस वो सब होता है, या फिर न्यूराइटिस, दैट इज द इन्फ्लेमेशन ऑफ द न्यूरॉन्स. ओके, so this was entirely about the sciatic nerve. Make sure that you are well versed with this diagram and with this diagram. So this completes our entire sciatic nerve. If you have any doubt, then please feel free to ask me. You can directly DM me on Instagram या फिर comment section में भी doubt डाल सकते हो. I will surely reply to it. Thank you so much.